Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a pleasure to have as my guest Dr. Tatiana Weisbrod. Dr. Weisbrod is a clinical assistant professor of aquatic animal medicine at the University of Florida College of Veterinary Medicine. She obtained her DVM at Cornell in 2017, followed by an internship in small animal medicine and surgery at VCA West Los Angeles and a specialty internship in aquatic medicine at the University of Florida. She went on the pursuit of master's and her research focused on pathology in Florida manatee calves. In 2023, she completed a residency in aquatic and zoological medicine and obtained board certification by the American College of Zoological Medicine. Upon completion of her training, she was ready to dive into her new position and celebrate with her friends and family. However, life had other plans. In January 2024, a biopsy confirmed a diagnosis of breast cancer. She has spent the entire of the year on the other side of the needle battling the disease, but in the process has learned to be a better advocate and more effective and empathetic friend, partner, and clinician. So, Dr. Weisbrod, thank you so much for being with me today and for being part of this show. I really appreciate it.
Of course. Thank you for having me.
So I met you as my patient, and I was you have such a great energy, I want to say.
Thank
It's
you.
like, yes, this sucks, but at the same time, it's kind of like, well, it is what it is, and this is how we're going to face it, and I'm going to be looking into what is the best avenues for me. But so that's why I was like, oh my God, you will be an amazing guest in the podcast. So I know you right now you are going through treatment, and sometimes some patients are like, let me just kind of get over treatment before I do that. And nope, here you are willing to just really share the story and try to help other people to kind of navigate through this easier than when you have to navigate through it. So I really appreciate it.
Got to keep busy. Happy to help.
Awesome. So, tell me a little bit about your profession, which you always tell me such a funny stuff. I always love to hear like what you do, but do you ever thought about becoming a veterinarian?
Yeah, that's an interesting question. I was not the person who was a little girl who grew up always dreaming of becoming a vet. Initially, I thought I was going to go to medical school to do, medical practice of humans. But I shifted gears after I completed my undergraduate degree. I worked at a zoo as an educator and got to work with amazing species and it was the first time in my life that I'd ever considered veterinary medicine. I had just, for some reason, just not had the exposure or the thought process. And once I found out that you could do veterinary medicine and also there was a path for aquatics, I hook, line, and sinker, that had me. And, I dove in and I've never looked back.
That's amazing. Why aquatics? Why that just kind of really caught your attention?
Everything about aquatic animal medicine is fascinating to me. I think within the field of zoological medicine, which is all of the species that you'd think of at a traditional zoo, aquatics is almost even more so in its infancy of medicine and surgery and research, and we're learning new things every day. So it's this huge open frontier that, I get to be a part of, which is very exciting and rewarding and also very challenging because you have to come up with novel solutions to problems that otherwise would be solved, via traditional medicine. So if you're going to do surgery on an aquatic animal, if it's a fish, how do you maintain that animal in its aquatic environment or keep it oxygenated while you do surgery? Things like this. That's really what kind of drives me and keeps me going. It's never a dull day.
Oh, wow. That's so fascinating. I didn't even think about that ever. Like, fish, well, they get sick, they die, period, right?
No, there's so much we can do to help them.
That's my naive like way of seeing, of course, depending on what kind of fish, but that's super fascinating. And you always tell me such a fun stories.
Yeah, fish get cancer too, and we can treat cancer in fish. So
So I'm gonna be asking some questions about that in a minute. So tell me a little bit about your diagnosis. So what happened? So how did you're very young, how
Mhm.
did you end up in this role?
So it was just a self-exam. I wouldn't say that I did them routinely, but occasionally I would, when I'm in the shower, just, good habit to get into. And I found this small little tiny, green pea sized bump on one side, and it was a little painful. So that's the reason I initially called my physician to ask about getting it checked out. She had let me know that pain was a little bit atypical for a cancer presentation, and given my age, I didn't have a family history of breast cancer, and I didn't know of any genetic predispositions either. The likelihood of it being cancer was pretty low, but she was still great about recommending imaging. And so I got imaging done, a mammogram and an ultrasound. And again, it was a little questionable about what it was. They couldn't really say for sure based on the ultrasound. Of course, the definitive answer came with biopsy. And I did elect to monitor it for a few months first, just based on everyone's low suspicion. So I watched it over a period of weeks to months, and it didn't seem to be getting better. It felt to me like it was getting a little bit bigger. So I ended up moving for a biopsy, and that's when my diagnosis came. And it was pretty much a shock. And I learned later on down the process, I didn't have any of those genetic markers either. So definitely it was a pump the brakes, surprise, kind of shock.
Got you. What type of diagnosis was it you want to tell the audience?
Yeah, it was an invasive ductal carcinoma. And it initially on imaging did not look like it had spread anywhere outside of the one localized region, but I did end up finding out that it was in one lymph node later on.
Exactly. So what happened about treatment after that was find out? What kind of treatment did you end up getting right after?
So everything starts happening very fast, and information hits you from all different directions, which is, I was grateful that things were moving quickly because it's hard to wait once you have that knowledge, but it's a lot to absorb. But my first step in the journey was to get an MRI with contrast just to check and make sure there was not additional concerns. Following that, I met with a surgeon who was absolutely wonderful, and kind of helped navigate what my path was likely to look like. And of course, she wouldn't know until the mass was removed and they got a little bit more information what exactly I would need in terms of treatment. But she outlined the most likely scenario, which was we definitely need surgery to remove the mass, very likely radiation, just because of the location of my specific mass. She wasn't confident that she'd be able to get great margins. It turns out she did really get great margins, which was wonderful. But she also talked to me about potentially hormone therapy if my markers came back positive for that, or potentially chemotherapy. Um, so those were all discussed, and it was overwhelming, but given my background in medicine, of course, I dove into the primary literature and I pulled every paper, article, everything I could find based on the limited amount of information that I had at that point. And I made sure that I asked a ton of questions of my team, and coming armed with a little bit of background and some knowledge was really helpful in terms of figuring out what questions I needed to ask. So all of that together helped me decide what I wanted to do moving forward.
Got you. So that kind of lead me into the next question. So you say that you, besides pulling articles and papers, what other resources did you find that was helpful to make decisions about your treatments? Anything you can just maybe advise the audience?
Yeah, I think for me, every question I had, I did follow it with a literature search. Just that's the nature of my being. So I
Yeah.
wanted to feel confident in my team, and also I wanted to make sure that I was informed as possible, without scaring myself, which was a delicate balancing act. So in addition to all of the reading, I did join a few online support groups for young women who are going through this and peruse some of the postings and the topics. I found it a little bit comforting in the beginning to feel like I was a little more part of a community and see that my questions had been asked before by other people going through it. And it was useful to read through because I gained a lot of knowledge about my condition and what options there were, not only for treatment, but also just support for yourself through the process. So asking lots of questions, doing a lot of research in whatever form that took. And then I do have the benefit of being married also to someone who's in the medical field. So I was able to talk to him a lot and bounce my concerns and fears off of him. And we were able to kind of make decisions as a team.
That's awesome. That's very good. If we go back a little bit into Tatiana, the patient, to Tatiana, the vet, how you compare those treatments for cancer on the species that you work with? How is that process? Like, if you compare like, a cancer similar for the kind that you have, certainly no breast, but you know what I mean. Uh,
Yeah.
so what is it for like, aquatic species that you can do in treatment besides surgery?
It's a great question. And we do have an entire branch of veterinary medicine. We have the surgical and medical oncologists that work specifically with our cancer patients. Mostly you think of that in terms of dogs and cats and maybe horses that are owned, but we are able to extend a lot of those treatments and therapies to aquatic patients or patients that are in that zoological realm. So it's very similar to human medicine in the sense that we still follow the same process. So we will get a biopsy or a tissue sample of suspicious masses so that we can have an understanding of what disease process is present. We'll usually do staging to look for distant disease and to find out if what treatment recommendations would be in the best interest of that animal. And then in addition to surgical options, we also have various chemotherapies that we can administer to patients. And we have lots of options in terms of treating disease. It just really matters quality of life for that animal and potentially side effects or long-term effects of whatever treatment we offer. We want to be cognizant of what that animal's job is, for lack of a better word. So is that animal going to be able to be itself? Is it going to be able to perform as its normal species counterparts would afterwards? Is it going to impair its life at all? So we weigh all of that since they can't directly speak to us about what they would like. But it's amazing. We can pretty much offer any of the therapies that you would see in human medicine to our animal species.
That's so awesome. That's so great. How about rehab? Have you been having any of them through rehab? Like I know about, therapy for dogs or horses, but I don't
Mhm.
know if I ever heard anything on the aquatic world.
Yeah, physical therapy or occupational therapy is a little more limited with aquatic species, just out of the fact that handling some of these species every single day would be potentially stressful, and we want to minimize stress so that they can heal and optimize their well-being. So there are options for physical therapy or things that we can ask animals to do for their own well-being. That's a lot easier in a managed care setting, like a big aquarium, when these animals already have people that they know and trust. A lot of them have behaviors that they're willing to perform, and we can ask them to do various swim patterns or laps or things that can get them moving or to benefit certain muscle groups. We can do passive range of motion, stretching. There are options. We just have to get really creative with how we operate that.
That's awesome. I may have to come and see you working with them one of these days. That'll be
Yeah.
cool. That'll be really cool to see. Okay, going back into if you can give us three valuable tips that you learned through your journey with your diagnosis, that would be great.
Sure. I think one of the best tips that I received prior to the start of my main treatment was to consider doing eyebrow microblading, which sounds funny, but it was a recommendation I got prior to starting chemo, and I was so thankful to have somebody bring that up to me because it gave me time to have it done before things started, and you don't have to worry about the healing process, that happens. You're immunosuppressed during chemo, so I was able to get that done before everything started, and for me, it was a mental safeguard definitely during these dark days of active infusions and especially with hair loss. It made me look and feel more normal. And as a side benefit, people who were naive to my condition, a couple of people complimented me on my eyebrows during the middle of active treatment, saying, "Oh God, your eyebrows are so great. Where do you go?" Which was a huge confidence boost in, the midst of all of the chaos and feeling very much not like yourself. So tip number one, if you think you might experience hair loss during your treatment journey, consider that. It's just a way to make you feel better about yourself, more confident potentially. Sometimes it's just the little things that make the biggest difference.
That's awesome. I did not even think about that. I'm gonna start giving
Me
that
either.
to patients from now on. I'm gonna be a tip for the patients. Hey, you may want to consider in this. Yes.
Absolutely my favorite thing that I was told. It just made me feel so much better. And you didn't have to bother with makeup, you don't want to deal with any of that while you're going through stuff. And this, you just woke up and it looked normal,
Yeah.
more normal. So,
Okay.
um, I think a second tip would be a lot of the chemotherapeutics used to treat breast cancer specifically take a significant toll on your skin and your nails. So I did a ton of reading about things that I could do to make myself feel better or protect my skin during that process. So based on that, I got a really good full body moisturizer and a cuticle butter. And I also used a nail strengthener. And I did that throughout treatment, and it really helped to alleviate that, tight, dry, terrible skin feeling. And it also made me feel like I had this very small modicum of control over a situation where you feel kind of out of control. So everyone's situation is different, but I would definitely recommend that you talk to your providers, your team about what options would be okay or best for you in your situation. But that definitely helped me.
Where did you get that information from? Medical oncology?
I did a lot of reading, so I pulled a lot of papers, and
Uh-huh.
I found a study that had recommended a specific niacinamide-based moisturizer, and so I did a lot of reading on that, and based on everything, it didn't seem like it would cause any harm, and they found some potential benefits, so I thought, why not? I would try that.
Absolutely. And works. You look great. So
Thank
awesome.
you.
Awesome. How about oh no, third. You have a third one.
Right. Third tip. Um, this one is more, I think, about mechanics, just things you might not think about when you're heading into this. If at all possible, I would strongly recommend that you take a trusted friend or family member with you to those initial appointments. It's a very stressful experience. There's a lot of information, like I said before, that's being thrown at you incredibly quickly. And having another person in the room with you is helpful for support, but also for writing notes. Um, Oftentimes you can't pay attention to or attend to what is being discussed. Once the appointment starts, you may not be able to recall things that you wanted to ask or talk about. You might get distracted. You're likely going to have some emotion associated with it. You might shut down entirely. So if you're able to come prepared with a list of questions and also bring somebody with you to help you, and you can read those notes later when you're ready to process things, that can make things so much easier and less overwhelming, and make sure nothing slips through the cracks either.
Yeah. This is such a great tip, and I see that all the time. I work with an amazing surgeons, and I know how like Dr. Spiegel can spend literally 2 to 3 hours with each one of you guys as a new patient. And she always tell everyone, or when they're gonna set up an appointment as a new patient, it's like you just may as well bring a book because I'm gonna run behind. And
Yeah.
so you guys already know ahead of the time, but you know that when you see her, she's gonna be dedicated and give you every piece that she has on her knowledge to try to really educate you in what's gonna about to happen. However, so I know that she will tell you everything, but when I then see patients, literally like maybe 2 weeks later or next week, it's like, well, the reason why you're here, you're here because you may perhaps will have a risk to develop lymphedema. And they're like, oh no, nobody explained that to me. And I know that she literally spent an hour talking about it. But again, it's because it's so much information coming to you.
Yeah.
And it's so shocking. And I think that the only thing that again, I can only feel for what I experience with you guys. I haven't been in your shoes, so I cannot speak for where you feel or you guys feel, but the common denominator I see is like, you just really, your fear is, I have cancer and I'm gonna die. Uh,
Yeah,
and then that's all is in my head and how I'm gonna avoid this. And then what's gonna happen with my family or whatever, my significant other or, kids or, parents, whatever it is.
yeah,
And then everything else is just really, like you say, comes to you so fast that a lot of people here is like, I spend another hour educating. And I know that after I start seeing you guys and we spend more one-on-one and stay longer time, it's still kind of reinforcing all those pieces of education as you go through every step of the way, right? From
definitely.
of post-surgery to radiation to chemo to radiation and otherwise because then it's hard to retain everything. So that's super important to try to really I think I always love to have their significant other or some family member or friend because again, two brains think better than one, one
Absolutely.
can take notes. We show you so many different things for you guys to do by yourself and even though you're thinking, oh no, no, she's smart, she's a vet, she's a physician, or whatever it is. But still, this is all new information to you, and how you process on your body versus when you process for somebody else is totally different.
Absolutely.
Yeah, so glad you mentioned that. How about the most painful lesson that you learned in this journey?
I think don't ignore changes in your body just because you're young or you feel super healthy or you lack a family history. I honestly wasn't too worried when I found my initial bump. I rationalized it away as likely being a cyst or some benign growth and probably nothing. And another thing too is that a lot of providers aren't aware of this significant surge in cases of breast cancer and specifically young women. It's not on their radar yet. I think it will be soon. There's a recent study out of Washington University at the School of Medicine in St. Louis, and they identified this huge spike in the number of women who were diagnosed with estrogen receptor positive tumors or hormone driven cancers like mine. And they also remarked that tumors in these young women are more often in advanced stages when they're discovered. And that might be in part due to breast cancer screening normally not starting until women are of an older age. So by the time it's detected, it may be more advanced in younger women who put off being seen or chalk it up to, it being something benign. So while we don't know what's driving that increase, it doesn't mean that you should not be vigilant and pay attention to any changes that might happen in your body and make sure that you advocate for yourself too, especially if you're met with a team who's maybe not as proactive as mine was.
That's great. And again, I was reading the article. Thank you for that. You sent me that. And yes, it is scary. And we
Yeah,
can talk a little bit about that, how it's not anymore breast cancer about you being, after 50 or
right,
60 is how we used to see it, is younger and younger patients are getting this. And then, what is it? Why is this a spike? And I'm so glad that you started a paper on it and they started looking after, how can we prevent some of this? And what is it? What's happening is the environment, is what we're eating, is what we get exposed to it, is what is it that
right.
is predisposing us more. And you actually, when we were discussing about this, you were saying, would be a great idea if they can just compare that with other countries, right?
Yeah,
It is something, it is how we eating, is how are we exposed here versus other countries, and see if that definitely is more environment versus just the disease itself. So very interesting to see where they go from that point into that
yeah,
paper. Yeah,
for
thank you
sure.
for bringing that up. And the other thing as well I wanted to bring into that, you say, just make sure you have a good team, and if you don't, find a good team. But
Yeah,
never feel afraid to have a second opinion. Don't trust everything the doctors say. A good physician is going to tell you, go get a second opinion if you would like to. When they say, no, no, it's my way and I don't like you to go see somebody else, then go find somebody else. It's like you just really have the right. And this is no, yes, it's cancer is something that you got to pay attention fast, but it's not something that's going to kill you tomorrow. You don't have to make a decision by tomorrow. right? So you're still having some time to like, let me just grab everything together. And it's okay to get a second opinion. This is not gonna grow 4,000 times within, within a few weeks
Yeah,
of getting a second opinion, right? So just make sure that you have that option and you feel comfortable and you trust in your team. That's super important.
I agree. I feel like trust in your team is paramount because you, at the end of the day, you have to feel comfortable with your decisions. They can make recommendations, but ultimately you have to live with what you choose.
Mhm.
So if you feel pressured into a decision, that's not the best way to move forward. You have to really feel like you can trust the people around you and you trust yourself as well.
Yep, absolutely. How the breast cancer impact your mental health, and what type of resources have you been using for this aspect?
So, I mean, going from a very physically active, relatively young, healthy person one day to a patient in a medical gown being told they have cancer the next was jarring, I think, to put it mildly. It was shocking. It didn't even compute, I don't think, for many days. I remember sitting in the consult room listening to the doctor talking about surgical options, and I felt like I was almost floating outside of myself, watching everything unfold around me from the perspective of this outside observer. It didn't feel real. It was kind of an all-consuming thing initially. It was the last thing I thought about at night. It was the first thing that popped into my brain when I woke up. It was and has been an incredibly hard, long journey. And I think there's phases to it to impact your mental state. At first, there's the terror of not knowing. So you don't have a diagnosis. And then when you know it's cancer, well, what kind of cancer? How bad is it? What stage is it? What kind of surgery am I going to need? Will I have to do chemo, radiation? Am I going to lose my hair? And then it transitions to the terror of reality. So you have a diagnosis and you might have a plan, but the unknown then becomes efficacy. So is my treatment plan going to work? Will I have a recurrence? How long am I going to live? Do the reported statistics represent me in my situation? And then I think finally there's this chronic, slow burning, almost smoldering kind of stress of living with your new situation. And you might struggle with the side effects from the maintenance medications that you're on. You worry about every new ache and pain. And, is that a metastasis? Or is that just something normal, like a normal person would experience?
Mhm.
And also there's this long, quote unquote, recovery period where you're regrowing your hair, you're gaining your strength back, you're coming to terms with your weakened body. And it's really hard not to spiral. Can feel very isolating, as you might have friends and family that are very empathetic, but not really understand your situation. They think, it's over, let's celebrate, your treatment is done. But in reality, this war just rages on and it's just less publicly visible.
Mhm.
So it was a wholly new experience for me to navigate, totally new terrain. So I was willing to open myself up and try a bunch of things that I maybe wouldn't have been open to in the past. So I added a lot of tools to my arsenal because I wanted to know that I had, exhausted everything. I'd really tried everything I could. So I worked with you in physical therapy. I also worked with occupational therapy, which was wonderful in getting some new tools for making my body feel better, and also giving me some strategies and some control. I also worked with team psychology and integrative medicine to try some other techniques. I developed a fitness and exercise program that I stuck to throughout treatment, and I think that helped my physical and mental health a lot. And I tried some things that I think didn't really jive with my personality beforehand. I tried mindfulness exercises, breathing techniques, journaling, yoga, um, some more successfully than others, I would say, but definitely willing to try it. Good nutrition was also super important during the journey. And ultimately, I did reduce the time that I spent prowling the internet, um, both looking up studies and also reading support group postings, things like that. I tried to focus on things that were within my own bubble of control. So I leaned on my support system a lot. I tried to accept help without protesting too much. And I tried to also maintain my social network as much as possible, even if that was just a phone call and I didn't feel up for anything else. So lots of options to try, but definitely a journey.
Got you. How about your husband? Was he involved? Because sometimes we're thinking a lot for ourselves. And we're thinking, I'm going through this process. And yes, it is your body. Yes, it is your mind. Yes, it is your body. And sometimes we just kind of like put aside a little bit. Not that we don't care, not that we are not worried about them, but certainly we're more worried about ourselves than them at that point, right?
Yeah,
So sometimes they are the one who has to take all the toll and hold back into all the feelings and the scary and whatever doubts they have.
yeah,
And and then sometimes I don't know if what is better. I don't know if it's better to know a lot or not that much. Because I
agree.
think that when you know it all, I think that you get more worried because
Hmm.
you're a physician. You have knowledge about what's going on, right? Maybe that's not his specialty, but he's a physician versus
Yeah,
somebody who is not, right? The least I know, the least I need to be worried about, right?
yeah.
So do you feel that he did any of that with you on the mental health part?
Yeah, I think you hit the nail on the head with that, and that you feel like you come at this armed with such knowledge coming from a medical background, but knowledge can be dangerous because you can let it get to your head. You think worst case scenario. You think if this were a patient, what would I be, thinking for them? So it's definitely a double-edged sword for both of us, and it's been hard on him too, and I think that is, like you said, important to think about the people that are close to you and when you're going through this, because it's also hard for them and they may not feel like they have a space to communicate that without making you feel bad. So I tried and continue to try to give space to him and the people in my family to express, what they're feeling as it comes up. And, are you afraid? What are you worried about? What do you think about this? And just giving them the space to talk. Um, it's, I have my own fears and things, so it's not shocking to me that they also have things that bother them. But my husband specifically was really great about, the entire journey, really. But he has been my biggest champion and, exercising alongside me every day, keeping me accountable. Did you do your workout today? Why don't you do it right now? Why don't you just go, do some yoga for like 5 minutes? And he also is into cooking, as am I. And so having a healthier nutrition plan was very easy to implement and to stay with. Um, and he was also very game for trying, things like the mindfulness activities, or we started at night trying to list, 2 or 3 things that we were super grateful for that happened that day, even if it was small. And we found that it did improve our moods, and thinking about even the small things that made us happy kind of distracted from the terror of reality.
That's awesome. That's very good. I'm so glad we talk about that. Um, how about any books that you would recommend for the audience and why?
So I'll be honest, I didn't read any cancer specific books or first accounts.
Yeah.
I felt like I had a scientific background to start with, and so I also wanted to protect my mental health as well throughout this journey. So in my elective time, I didn't want to focus on cancer and reading stories about cancer. And everyone is different in what they find comfort in. And hearing somebody else's experience might be very comforting in terms of a book for somebody else. But I did do a fair amount of reading. There's a lot of downtime post-op. And, when you just don't feel like, watching TV or doing that. So 3 book titles that I read recently that I think are great as a distraction for people that are looking for a good read. One is Braiding Sweetgrass,
Okay.
and it's a nonfiction book by Robin Kimmerer. And it's this peaceful, relaxing, basically love story about our natural world. And she's a professor at a university and she focuses on plant science, but she discusses the intersection between that science and her indigenous knowledge from her cultural background. It's
Nice.
just a beautiful book to get lost in.
Mhm.
The next probably won't surprise you. It's aquatic themed. um, The Secret Life of Lobsters.
Oh, cool.
Great book. That is a Trevor Corson book, I believe, and it looks at biology, sustainability, conservation, and history from the perspective of lobsters themselves, fishermen who go out in search of lobsters, and also scientists. And it is wholly entertaining in the process, a great read, even for people that don't really particularly have any known interest in crustaceans. And then the third book that I read, and this was a reread, but it was worth it, was A Walk in the Woods by Bill Bryson. He's one of my favorite authors. He has this ability to transport you to wherever he is writing about so that you feel like you're walking alongside him and experience everything. And this book was about the Appalachian Trail.
Oh, cool.
So in recovery, when you can't go any place and you feel weak and you can't travel, it's very transformative. You can go someplace, through the pages of this book and feel like you're actually doing something as a little escape.
No, that's nice. I love that. That's great. Is any activities that you would recommend doing your cancer treatment?
Yeah, I will echo probably what you tell a lot of your patients, and I know that you encouraged me as well. Stay as active as possible every day if you can, and it definitely might hurt on certain days more than others. That's okay. Do just whatever you're able to do, but I always felt so much better afterwards, even if it hurt during the process. And it helped with fatigue. I think it helped with pain. And another benefit is I think it made it easier, although I'm nowhere near where I was before my diagnosis, I think it made it a lot easier returning to normal activities after your active treatment. Um, Before treatment, I was bouldering and indoor rock climbing and doing things like that. And I didn't do a lot during my treatment, but I've been able to go back to it during radiation. And I don't think I would have been able to otherwise if I didn't stay active and try to keep up my muscle mass and things like that. So I would say as much as possible, get in your cardio, get in your weight training. You will not regret that.
Yes.
Um, and then find an escape. I'm a creative person, so anything that involves, drawing, painting, working with my hands, you have a lot of time on your hands during phases of treatment. So all good ideas for staying busy.
Great. And I love it when we just start this podcast. You're like, oh, I just have treatment today, radiation, and I did a hit right prior to it. So
Yeah. Yep. Got
yes,
to schedule it in when you can.
yes, exactly. And that really makes a difference. I think I have seen over and over and over so many less secondary effects from this chemo and radiation when you really get yourself up there when you need to get. Your recovery time is faster. Yes, perhaps mainly I would say during chemo, it's going to be days during chemo
Yeah.
or weeks during chemo that, you have complications and that's not going to happen. But like you say, just doing 5 minutes of any activity, a little bit yoga, whatever it is that you want to try to do, that's better than nothing. And then the moment you start to feel a little bit better, the moment you do it, boom, your energy comes right back. So that's super important. Um, do you feel that you experience any trauma during your treatment?
Yeah. Starting chemotherapy specifically was very hard mentally and physically. And you'd think coming from, a vet background and working with animals, you'd have this idea of, what it's going to be like. And I think most people, medical or not, have a mental image of what chemotherapy looks like from TV or movies or books. And I was pretty optimistic coming in relatively healthy, but the actual experience was harder than anything I could have imagined. And there are these expected traumas with chemotherapy of, being tired, maybe you're a bit nauseated, of course, depending on which protocol you're on, losing your hair. I think hair loss for me was relatively traumatic because I felt like I lost my external veil of normalcy. So you go from externally not looking sick and suddenly experiencing this extreme, rapid, almost vulnerability where you can't hide your sickness anymore. And it feels like everyone knows. even though, maybe that's not the case and it's in your head, it feels like the second somebody lays eyes on you, they know exactly what's going on. And so suddenly mundane tasks like going to the grocery store become stressful because you have to think about like looking normal or trying to. And I hated the intention it drew when you go in public. And I did experience a hurtful comment or two throughout the process. Obviously, you stick on those stick with you mentally more so than any of the positive. I got a comment like, women look better with longer hair,
Oh
when
my
you went
God,
out.
are you serious?
Yeah. And so it's real hard, even if you get one of those, it can really just stick with you for a long time. And mitigating it is not straightforward. At least for me, it wasn't, because even though, I shaved my head when it started to fall, my scalp was extremely sensitive and it hurt to have hats or wigs on. And wigs themselves felt pretty alien to me when I started wearing them. So dealing with that wasn't, easy in any way. And then there's kind of more unexpected things. Like I had an intense reaction to my first infusion with some pretty rough side effects. This really severe skin reaction that was exquisitely painful and also, to be honest, very ugly to look at. I did not want to be seen by anyone. I ended up having to switch medications. And with the new one, I had this severe bone pain. Neuropathies rear their ugly head when you're under treatment. And you have these unexpected indignities that no one prepares you for or talks about, like losing your nose hair. My nose ran all the time, which was awful. You're very sensitive to aerosols or anything in the air because you lose that filter, or losing your eyelashes. That was also more
Yeah,
so than just hating the way it looked. Water from the shower or sweat would just run straight into your eyes because there was no barrier.
I remember.
Um,
Yeah,
your mouth gets hit hard. Your saliva glands may not function. Mine got really painful. Your taste changes. Your mouth may get sores. There's just, a never-ending list of things that can happen that you just kind of stumble upon. So that entire experience, I think, was just traumatic to deal with, whether those were big things or even just tiny things.
how do you just deal with that now? Like, again, you just were trying to do the best and using all that strategies that you were trying to do as little by little you were going through that. Yeah.
Yeah, as it came, I tried to stay in contact with my medical team about things that I thought were, severe enough to warrant communication. And then for the things that felt like things that were out of their control, there was nothing they could do about it. Just trying to find strategies or, treatments that could help take away some of the pain or discomfort. And some of that was trial and error. I also had the benefit of talking to a couple of friends, unfortunately, who also were in a similar position as me and going through cancer either before I started my treatment or, concurrently. So we were able to bounce ideas off of each other and help support each other.
Okay, very good. Um, what is your input in learning to feel safe in our bodies have experience a threat to the life from cancer?
Yeah, that's a good question. It's incredible to me to see what our bodies are capable of withstanding and ultimately healing from. It's almost like watching a forest heal after a really severe forest fire. There's initially, it feels like everything is lost and broken and, there's no life there anymore. But relatively quickly, you start to heal and feel stronger. Your eyelashes start to come back and your brows, your hair starts to sprout, almost like pioneer plant species after that fire that first grow back. And it takes time, but eventually things start to heal and they may not look, or they probably won't look exactly like what they did beforehand, but you can still get back to this feeling of being a whole person again. And you become a forest eventually over time. It just takes time. So this experience has taught me to listen to my body a lot more and to do everything in my control to keep it healthy, because it's been pretty incredible watching it heal from the insults that I have heaped upon it.
Yep, yep, absolutely. Hang in there. How much longer for radiation?
2 weeks.
Awesome. Almost there. Almost
Yeah.
there. Almost there. What is one question you wish I would have asked you and what you have answered?
Um, I think something that I've noticed that was important to me in this journey was how cancer impacted my relationships, both personal and professional. And I think we touched on that a little bit in discussing how to support our partners or our family members, but I feel like I've learned a lot about how to be a supportive friend and as well as a partner. And I was very grateful to have the support system that I had during this treatment and presently as well. An example that really changed how I act with my own family and my social groups is instead of specific friends or family members asking what they could do to help or saying, if you need something, let me know. Some of my friends just did things. And I truly appreciate that more than, any of them could ever really know. The random phone calls to check in and just catch up and talk about nothing, or sometimes friends would just show up and drop off, a pizza for dinner or something like that, or leave little tiny care packages with like a puzzle book, to do while you're sitting at home, or a cozy hoodie for your infusions, or just, being bombarded with funny memes via text just to keep you laughing. They took action in the best way that they knew how. And it was very impactful because sometimes when you're going through this, you don't really know what you need, or you don't really want to ask
Yep.
anyone. So moving forward, I kind of plan to put that into practice and really invest in my friendships and relationships the way that they've invested in me. And professionally too, I think it's been a time of reflection for me, because I've been on the other side of the needle as a patient now, and it's been a very eye-opening experience. So I do feel like I have a new awareness of how overwhelming medical scares can be and how patients and their families might feel in various situations, and how stressful it is waiting for a doctor to call you back or to, get a test result, and how vulnerable it feels when you're the patient on the table and there's multiple people involved in your appointment talking about you or your diagnosis, but not really to you, and you feel just kind of ornamental. It's important to be able to deliver information, especially medical information, in an accessible way. And I think I've learned a lot about that as well. And despite working with animals, those people skills are just as important.
Oh, yeah.
And I feel like I'm more empathetic now than I even was before.
Yeah. Yeah, you're right. And sometimes it is, I can totally see that. And I don't see it so much, situations like you come to outpatient and you go see the doctor, and then it's in an outpatient base. So sometimes I don't think I see that a lot. I experienced that in the hospital.
Yeah.
My husband has to have an admission because back pain. And I remember, like, doctors, or even I work sometimes in North Florida, in acute care, and sometimes the doctors are outside talking and the patient
Yes.
is inside with the significant others listening, and the docs just kind of like talk about it and just continue moving on. They don't even come in the room to say, by the way, yes, we were
Yeah.
talking about your case and blah, blah, blah. So I just, sometimes, the patient caregiver has to come out and say, are you not planning to talk to me? Like,
Yeah.
it's like, we hear you, but we need to know what's going on. Nobody's giving us information. So sometimes I know it's hard, and I know sometimes, physicians are busy and life is busy, and you're going in a hospital and you have multiple patients to go see, and one take priority. But you're right. I don't think that sometimes we lose that human part of who are we dealing with? Are we dealing with an MRI? Are we dealing with a PET? Are we dealing with a cat? I mean, a diagnostic tool, or are we dealing with a human being, and we should be treated as a human and not just as okay, it's like you say, it's just something, an object there that I'm
Yeah.
to figure out how to help that object, but I'm not taking in consideration that the whole human being. So
Yeah.
I think that sometimes, it's sad how in the healthcare system now, because the way that the health system is, right? Where physicians have to see how many patients, and you just go room to room to room. I'm like, you're here for this, and you have 5 minutes, and boom, 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 boom. I gotta go move
Yeah.
on. Then it's like, okay, and again, I understand how sometimes patients can have 1,000 questions. I know you don't have the time with your physician for 2 hours to ask all those 1,000 questions, but sometimes I think that from the medical standpoint, I think that we gotta be a little bit more humans and see like, if that will be my sister or my wife or my mother sitting there, then do I wanna have the answers and so have it to be more empathetic with
Right.
me, right? So sometimes, unfortunately, when we are in the other side of the needle, that's when we experience that. And we shouldn't be that way, right? We should just be better humans, period. But we are not, because sometimes we just kind of get going with
Yeah,
life.
it's hard, especially with burnout and
Yeah,
caseloads are high right now for everyone. So it's easy to just become a number and to try to just get through your day.
exactly, exactly. So kind of glad that at the end we always have to see from all this journey what are the positive things we always want to remember, and how is that making us feel better about who we are and what we do, right? Like I don't think I was having on my mindset and how I was when I was an orthopedic physical therapist.
Mhm.
Definitely, you guys has been teach me so much every single time, right? To just kind of like, okay, how do we address this and how do we address that, and how it's like, oh my God, like the comment you just say that somebody did to you is like, if I hear that, I will so aggravated that I will go after that person right now. Say that to
Yeah,
you. And I'll be like, what in the world are you talking about? It's like, what?
yeah,
And I think that, we just kind of make us feel a better human beings. And I really appreciate you doing this with me. I know it's not easy to talk about your story when you're still in the process of the treatment of the story. And I really appreciate, but I think people is gonna love when we release this episode. They're gonna really enjoy all your knowledge and all your advice. And I think that has been super fun having you in this journey. And I know we're gonna continue being in this journey for a few years as we
yes, we are.
following you in your surveillance. But thank you so much for doing this. I really appreciate it.
Of course.
Yes, thank you, thank you, thank you. And you have a great weekend. Go take a little breather, get your
Can't wait.
skin breathe, and just rest and just enjoy it.
I will. Thank you.
You're welcome. Take care. Bye.
Bye.